Hi friends, today let's discuss about the restoration of a cervical lesion, the so-called class 5 restoration. As we all know, uh, the class 5 restorations are one of the most underrated restorations in dentistry. So let's see a few cases on restoration of the cervical lesions. So see this case for example, this was restored and you can see there is a cervical restoration. Still the patient had sensitivity. Just see this photograph. I have just placed a retraction cord, and let me stress upon that point again. We need a heavy retraction cord in our restorative cases. You can see a type 3 retraction cord or size 3 retraction cord is packed over here. See the vertical displacement of the gingiva, and you can see a big defect, which was the real culprit for the sensitivity. Now let's see how to manage this. So I had to do a bit of cautery. You can see the gingival margin was excised, the defect was exposed, and the old composite restoration was removed with air abrasion. And it's very important. We are not going to use any hand paste for this. We would be using air abrasion to remove the old composite. And then it was restored. And see the gingiva now? I would say it's butchered. But see the 2 days, 48 hours follow up. The gingiva is nicely forming around the restoration. It's been clearly established that to any polished composite, your gingiva reattaches. Now let's see another case, a bit more severe, class 5, almost like a root canal treatment case. We did a pulp vitality test. There was no need for a root canal treatment. The tooth was responding normally. After the cautery, rubber dam isolation, and then the caries detector dyes was applied. And you can see all the outer caries dentin was removed. We have done immediate dentin sealing, very important in dealing with deep lesions. Immediate dentin sealing has been done to reduce the stresses. Rebond fiber was placed. You can see the rebond fiber here. And then the restoration was completed. And this was followed by re-restoration of the occlusal defect 2. The class 1 composite restoration, which was earlier done, was repeated. Again, you can see the rebond fibers here. See, that is the class 5 defect immediately after the restoration. This is the immediate post-operative. Let's follow up this case. This is the 2 months follow-up. And you can see how beautifully the gingiva has formed in a couple of months' time. So here we have avoided a root canal treatment. This is the most important thing as dentists we should do. Whenever possible, we will try to avoid a root canal treatment. That's the IUPA. So stay tuned for more cases like this. Good night.